Okay, so you're thinking about having Morpheus. You've heard a lot of things about it, how it can improve scarring, how it can tighten the skin, and how it can reduce fatty tissue as well. But is it actually as good as all the marketing companies seem to claim? My name is Dr. Roche. I'm an aesthetic physician. I've been in the industry for the last 10 years, and I teach people around the globe how to do these sort of treatments. I've also been offering Morpheus in some of the clinics I've worked in for the last 4 years, and I've done well over 500 treatments. I'm going to go through with you today the good stuff about Morpheus, the bad, whether it's actually a good treatment for you to have as an individual, the complications, and everything you need to know to make an informed decision about whether Morpheus is actually the right treatment for you. So let's get into it. To understand Morpheus, we need to understand how it actually works. And it's divided into two different technologies. One of them is microneedling and the other is radiofrequency energy. Now, microneedling is something that we've been using for several decades, and it is a good technology. It's tried and tested. Regardless of whether you're using pneumatic pens or whether you're using dermal rollers at home, the essential idea is that you're trying to create micro trauma to the skin. When you do this, it creates collagen stimulating factors so that you have a higher flow of blood flow to the area, more collagen, and the skin looks thicker, firmer, and it can also help with things like acne scarring as well. Now, I've done microneedling, I've done it for many of my patients and myself. I think it's a great technology and it's fairly safe. Now let's compare that to radio frequency waves. Now this is essentially a very high energy that you are transmitting into the skin. And what this does, it helps coagulate the fat underneath the skin. So by fat coagulation, I'm essentially talking about how you cook bacon at home. When you cook bacon, the fat all shrivels up. And that's essentially what you're trying to do to the fat underneath the skin, the subcutaneous fat. So if you shrink up the fat, then hopefully you will shrink the fat under the jawline and you'll create a more chiseled jawline. So it's great for creating more chiseled jawlines, but there are certain areas where you don't want to create fat loss, for example, the cheeks. And that's one of the first complications that I see quite commonly when it comes to Morpheus. This brings me on to my next point. Morpheus is extremely practitioner dependent. Please do not go to someone who's offering very cheap prices because it's likely that they don't know what they're doing. There are two important considerations every practitioner needs to think about before moving forward with a Morpheus treatment plan: the energy and the depth. Now, we have to make a decision about what's appropriate for the patient in front of us, because if we choose the wrong thing, disastrous consequences can arise. There are different depths with Morpheus treatment. So you can go from 1 millimeter all the way down to 7 or 8 millimeters. And obviously the deeper you go, the deeper the needles penetrate, the more issues are going to arise. You can hit things like blood vessels and you can cause real damage to the deeper layers of the tissue. If you think about the energy, if you do too high energy for a patient who's simply not ready for it, then that can also cause significant harm to the skin. So really important to go to someone who understands your face and makes a tailor-made treatment plan for your entire face. For example, I will always go at a lower depth at the forehead because the skin is much thinner compared to somewhere like the jawline. I will also go at a higher energy for places that have more tissue that needs to be tightened, for example, the jawline. Now that I've given you a basic idea of how Morpheus works, needles go through the skin, you initiate radio frequency waves, and it helps tighten the skin. You now have a basic idea of how Morpheus works. The next thing we need to discuss are the possible side effects and the pain that's associated with Morpheus. Now, I won't lie to you, Morpheus8 is stingy. On a pain scale of 1 to 10, I would say something like an 8. The other thing you need to know is that the procedure actually lasts for quite a long time. If you're going to someone who actually knows what they're doing, they should be spending anywhere between an hour to an hour and a half actually doing the procedure. And this is because you're treating the entire face. You need to change depths, you need to change needles, you need to do all sorts of things to make sure that you're getting the treatment right. Now, we've discussed how it works, but essentially what's really important to understand is that whether using microneedling or radio frequency waves, both of these things are actually creating inflammation in the skin. Now, this sounds a little bit backward, doesn't it? Because we all know that inflammation actually causes aging. So why are we treating inflammation with inflammation? And there lies the crux. This is precisely why I don't like treating my patients with Morpheus anymore. I'd rather use something that will help improve their cellular function, help improve their homeostasis, rather than causing inflammation to the skin. And that's why I no longer perform Morpheus treatments for my patients. Instead, I direct them to another treatment that I offer, which actually improves cellular function. And I'm going to leave a link in the description below so you can watch my video on Sunicos, which is, in my opinion, the best skin injectable in the world and outperforms Morpheus in multiple different ways. But you're here to learn a little bit more about Morpheus. And the one complication that I really want you to understand is the fact that if you overtreat the cheek area, the medial cheek area, it can actually cause significant hollowing. Now, this is really good if you're treating the jawline because you want the area to tighten and you want to have a reduction in fatty tissue. But if you're, say, in your 50s or your 60s and you think having a full face of Morpheus is going to improve things, sure, it might improve a small amount of your jowls. But if you hollow your medial cheek, it's actually going to end up making you look more gaunt and more tired. So the things that you really need to make sure and think twice about if you're moving forward with Morpheus is A, if you have a Fitzpatrick scale of 3 or below, so essentially if you have a skin tone like mine or darker, microneedling can actually make your pigmentation worse. And the second thing you need to factor in is whether you already have slightly flattened off cheeks. Because if you treat that area with Morpheus, it's going to end up to more hollowing and it's actually going to make you look more aged. Now, we've talked about the complications of Morpheus, we've talked about how it works. It's important to understand who's actually suitable for it. So, in summary, would I recommend Morpheus? The honest answer, even though it made lots of money for myself and my clinic, is no. I wouldn't recommend Morpheus for most patients. Sure, there is a certain subset of patients who it might be useful for example, a patient who has a light skin tone, who has no hollowing in their cheeks, but it is extremely jowling. If you're that patient, then sure, move forward with Morpheus, and I think you'll get a very good result if you go to someone who knows what they're doing. But most patients don't fit that demographic. And if you use Morpheus when it's not actually the right thing for you, you're going to risk increased pigmentation, you're going to risk hollow cheeks. It's a painful procedure and you're paying through the nose for it as well. The retail prices for Morpheus for 3 sessions are anywhere between £3,000 and £5,000. There are far cheaper alternatives out there that can create a much better result for you. So no, I don't think I would recommend Morpheus. But if you want to learn more about what's actually appropriate for you, a tailored treatment plan for you, then be sure to click the link in my description and we can have a face-to-face consultation in one of my London clinics, or we can even have online video consultation regardless of wherever you live. And hopefully I'll be able to take you on that journey to make your skin a little bit better.